Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, and I would officially like to welcome you to episode 53 of the Ask Dr. Angela podcast. Please bear with me. I have a pretty extreme case of laryngitis, but you know what they say. The show must go on. So I'm going to jump right into today's question in an effort to save my voice. So today's question is something that I get asked a lot during visits, specifically with my prenatal patients, and especially during this season. What can I take for a cold during pregnancy? My response primarily has to do with what you normally take for a cold when you're not pregnant. Of course, there's going to be good old chicken noodle soup, mom's favorite, plenty of fluids. Hydrate, hydrate, hydrate. Medication-wise, extra strength Tylenol is fine for aches and pains. Robitussin is great for a cough. I like Mucinex for congestion. I'm not a huge fan of Sudafed because of pseudoephedrine. That can sometimes lend itself to causing tachycardia as well as hypertensive issues. Humidifiers in the house, specifically in the bedroom, are a good idea to try to keep the air nice and moist. And saline nasal spray to help keep the nasal passages moist are also a really good idea. So hopefully today's topic on colds and what to take during pregnancy helps out pregnant moms who, I'm sure, if you haven't already dealt with this, will certainly deal with this during your pregnancy. Thank you so much for all the love that you all continue to show me. I love the pics that you guys are posting on my social media wearing your bomb-ass Ask Dr. Angela t-shirts. There's more where that came from. If you want a t-shirt, all you got to do is go to www.askdrangela.com, click on the microphone on the right-hand side of the page, ask your question, and boom, do what you do. In closing, I'd like to leave you with this. Obstacles can't stop you. Problems can't stop you. Most of all, other people can't stop you. Only you can stop you. That comes to us from Jeffrey Gitomer. Until next time, look better, feel better, be better. Thank you so much for tuning in to the Ask Dr. Angela podcast. Hopefully next time I'll have a little bit more of a voice. I'm looking forward to reconnecting on episode 54.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.